Thank you very much for having me today. My name is Cal Beyer. I was asked to cover the topic of the intersection of suicide prevention and workplace and job site safety. I work for a company called Holmes Murphy. We're a 90-year-old insurance brokerage firm based in Des Moines, Iowa, with offices across the country. For the prior 7 years, I worked as a risk manager for an asphalt pavement contractor in Washington State and Oregon, with operations in Idaho as well. I serve on the executive committee for the National Action Alliance for Suicide Prevention. I continue to be very active in the construction industry. I cross over and help other industries address workplace mental health, substance misuse, suicide prevention, addiction treatment, recovery, overdose prevention, and opioid risk reduction. It's an honor to be here. This collaborative partnership is between the United Suicide Survivors International and the American Foundation for Suicide Prevention. And you're aware of the 8 guiding principles. You're also aware of the 9 practices that make this suicide prevention, safety, and health priority in organizations. I'm going to share ideas around this industry activation strategy that I helped launch. I'm going to review what I call a progression roadmap. And then we'll spotlight some successful adoptions and then highlight challenges and opportunities for further improvement. So this industry activation strategy, when I left the insurance industry as an executive, went to work for the paving contractor, it was with the vision of baking mental health and suicide prevention into safety, health, and wellness culture. And what we had to do was cast a very bold vision. It was around these ideas of caring cultures and ultimately reframing safety 24/7. I had 4 initial strategies, pillars to this campaign strategy. Media saturation. Between 2009 and 2015, there'd been really one industry article in construction that referenced suicide. Today, you could find over 500 different articles on this topic in almost every trade. The next 2 pillars were really important. It was penetrating industry or trade associations. The third was getting participation by labor unions. And the fourth, because we knew this was going to be such a big challenge, was to build an army of helpers. And in our early work with the National Action Alliance, I built this 4P framework, and I was tracking all of these initiatives that we were building jointly. Could we get publication opportunities, to generate presentation opportunities, to build partnerships, to develop projects? And it's so cool to see this effort continue. This has been an organic growth model, and that 4P framework was really helping to energize and catalyze this continuous movement. And then started doing regional summits, really under the banner of the National Action Alliance for Suicide Prevention, initially with Construction Financial Management Association, CFMA. And then we continued to move upstream, and this is where we saw expansion to the substance misuse. And then we looked at needing to do more with addiction treatment recovery. And that's where I dissected or redirected a lot of my efforts to work with the opioid issue. And then what we really had to do was continue to leverage those stakeholder partnerships. What's happened in the construction industry, back-to-back roundtables, the construction working minds. That's an example of what happens when you activate an entire industry. You build this whole ecosystem. All the interconnected parts start to transform this conversation. It went from taboo in 2010, went to skepticism in 2012, some cynicism by 2014, but less than 10 years later, to see this fully activated is dynamic, just really exciting. So the progression roadmap, for me, this started in 1992 to 94. I did my first suicide prevention project in the workplace, and it was why are people attempting suicides in jails? I'm a risk management, safety, and health professional. I was a public entity specialist for 10 years before I came to construction in 1996. We did it on the basis of critical incident response. That's to address the emotional needs of employees in the aftermath of a traumatic incident. And that continued post 9/11 and up through Hurricane Katrina, 2009-10, right at the time the Action Alliance was forming. This was still our main pathway. And then we started calling suicide prevention and mental health the next frontier in safety. The third major wave in this roadmap was total worker health. And it really broadened the scope, looking at underlying health conditions, physical, comorbid health conditions on employee benefits, chronic health conditions, looking not only at absenteeism, but presenteeism. And prior to that, we did have the reframing of safety 24/7 culture. So sorry, I went out of order there. That reframing safety 24/7 culture was saying it's not enough to get people home safe at the end of a shift. We had to reframe that. If we truly have a safety 24/7 culture, we've got to focus on getting people back to work safe from home. Regardless of the struggle, many people were suffering in silence, and the workplace gave us a safety net because we had caring cultures, we had peer support, and we also had employee benefits, including employee assistance programs. So then that total worker health was concurrently expanding. NIOSH, major initiative, many offshoots of that program, continuous funding in those NIOSH centers have really expanded the work that's being done. And the next major pathway was this idea around mental health, suicide prevention, embedding it into diversity, equity, inclusion, and belonging efforts. And then we've gone to well-being, this birthing of mindfulness, resilience, teaching people how to handle stress and reduce that stress. This has been a pretty dynamic process over the last 20 years, but particularly in the last 10. So I wanted to share, because this intersection between suicide prevention and job site or workplace safety, I use this adoption cycle frequently when I'm talking to people. That catalyst was where this starts. That can be an event. Sometimes people have called that a trigger. I find that to be a little bit emotionally challenging, or it could be a change agent. So the catalyst, and that person demonstrates concern, drives commitment from the organization through the leadership. It spawns that caring culture or reinforces why we have a caring culture. And then you need to cascade the resources and the communications strategies to reach every employee. Again, it's more than it's not okay to be okay, but it's teaching people that help is available. So we've always been intentional about saying hope, help, and recovery. And that's really powerful at reducing stigma. It reduces barriers, improves access to care. And what's great when you have those efforts, other companies are leaning in to see what's happening. With collaboration, we can develop campaigns. And I'll give some examples of where these adoptions have been very successful. So collaboration is a great thing, and that leads to cross-pollination. I've been using this word ecosystem with some developers and some general contractors to say, if you could impact everybody in your ecosystem as your company, from your suppliers to your customers to your trade partners, this is how we will get mass adoption. What I wanted to do is just give a quick example of many representative industry adoptions of suicide prevention as safety, health, and wellness initiatives. This is 3 initiatives in public safety among many, and there are 3 that really started circa 2010 with the National Action Alliance, up now through Responder Health and Employee Benefits Program that's embedding substance misuse peer-to-peer coaching support. The Construction Industry Alliance was next, formed in 2016, became a separate nonprofit 2018, recently hired their first full-time executive director. I love what the American Veterinary Medical Association has done. They had 2 paths, well-being and then get help for crisis resources. On the well-being side, it's as comprehensive an industry prevention strategy that I've seen. We could do the same with rural and agricultural communities. And the reason I included this is many industries are in rural areas, and we know that they're mental health deserts. 65% of all counties in the US don't have adequate mental health resources. There's been pooling of various federal funding in various sources to provide support and resources. So not just for farm families, but this includes rural businesses as well. And these 3 sites have been powerful, me helping probably 10 different organizations every month. The restaurant and food and beverage or food service industry has done a lot with substance misuse. And I'd always been concerned that they weren't doing enough with suicide prevention. This is one of a couple of initiatives. The other one I wasn't able to get good information on, but Each Mind Matters is part of this California initiative. Big jump in suicide prevention. I'm excited to see that industry continue to embrace. A couple other real quick highlights. We've seen dentistry and we've seen healthcare prevention or healthcare workers with suicide prevention initiatives. I'm proud I still live in Washington State through Forefront Suicide Prevention. There have been legislative requirements for some of these allied healthcare professionals to have suicide prevention training as a continuing education program. We'll continue to see some great things as more states do that. And then in 2018, I just wanted people to be aware, this was really one of the first audits that we'd seen for suicide prevention. QPR, Question, Persuade, Refer Institute. And I loved how they were sharing this. Copyrighted, but it's free to share. And that was just the right spirit of what we see. Nothing is proprietary when we're trying to save lives. That's a hallmark of safety culture in almost every industry. And I wanted people to just see some of the progression of these adoptions. Sometimes people were nervous that there were these new spin-offs or spring-ups or startups. And I felt like this is a good thing. This is how we're going to get more buy-in locally. So in Oregon, the Construction Suicide Prevention Partnership started in Missouri and Kansas with the Construction Suicide Prevention Week, broad expansion nationwide. And then in Ohio, a Too Tough to Talk, a true joint labor management initiative that's really driving that whole ecosystem. An Engineering News Record really showed how far this initiative had come. 2021, this was the cover story. And the first real reference to the intersection between physical and mental health came in the 2021 Construction Safety Week national campaign talking about holistic safety. Really, really dynamic, really exciting. The following year were these resources, and it showed how embedded this has become in our particular industry of construction with these resources for mental health, addiction, and suicide prevention. A few more examples to just show how this intersection of suicide prevention and safety has become pervasive, and it's really been embedded into safety community nationwide. This is an OSHA publication referencing a 5-step plan. You've got the American Society for Safety Professionals focusing specifically now on suicide prevention. They're being bolder. And then you've had this partnership between OSHA and the American Foundation for Suicide Prevention. The latest of these initiatives has taken the construction efforts in multiple countries and gone truly global. And this is an initiative called Get Construction Talking. And it's identified 5 international charities in a collaborative campaign to raise $1 million. And the last thing I'd like to highlight today would be some additional challenges. We've got to all continue to collaborate. Let's not worry about competitive efforts or movements. Innovation happens when we collaborate. We get that cross-pollination. We can take this to broader populations. We got to break silos and stigma, and we do that when we're all vocal, visible, and vulnerable. And that's how we break down the status quo. And the last 2 areas I want to highlight are areas that I spend a tremendous amount of my time. The only reason I left the paving contractor is I felt if I could get this embedded into employee benefits, I could impact between 100,000 and 1 million lives per year. But everyone needs to understand and learn about union-sponsored and employer-sponsored health plans and the services that are offered and the better coordination of mental health services and behavioral health needs of plan members, especially dependents on families. And the last item is leveraging technology. This is going to be the future. I am seeing so many point solutions, apps, technological innovations that are occurring, not just wearable technology, but true digital platforms that are transforming the way digital healthcare is being provided. Not just telehealth, but real reaching behavioral health. Want to give an invitation for anyone that's new to take the pledge. Thank you so much.